Welcome to Southwest Virginia, Marion, Virginia. We're here at Emory and Henry College's School of Health Science today, and we'd like to welcome you here to our PA program to get to learn a little bit about the school, the program, the profession, the history, and also we have a free clinic called the Mel Lehman Free Clinic available to the community. My name is Victoria Justice. I'm principal faculty here at the PA program. We have some PA students and our faculty as well as our director waiting inside for you to come and meet and to share some of this information with you. So let's go inside. Here we are in the School of Health Sciences lobby with some PA students, and we also have with us Miss Laura Dow, who is our PA program manager. I'd like to ask the students some questions about Marion, Virginia and Emory and Henry and see if they could share some information with you. Derek, I understand that you grew up in this area and that it was a very personal decision for you to come to Emory and Henry School of Health Sciences as your for your PA program. Could you share that with us?
Growing up in Marion, Virginia, I've had the opportunity to watch it grow and develop. I can remember driving downtown as a kid and it was a ghost town. And now as I drive down Main Street, I can see new shops, businesses, restaurants, and just people hanging out. And now I know that I never want to leave.
That's wonderful. This was really a childhood dream of yours, then it sounds like, to come and to see things grow, and it's really developed well. Beth, I believe you're also from this area, the regional area. Could you share with us why this also was a personal decision for you?
Yes. I grew up in a small town in Southwest Virginia and was always taught to give back. When I decided to go into the medical field, I knew I wanted to stay in the area and work for a small rural hospital. I have always been an advocate for compassionate health care, and I believe that the relationships built in a small community is best for attaining vital health care for my patients.
That's wonderful, Beth. It sounds like you really made a very thoughtful decision when you chose Emory and Henry School of Health Sciences for your PA program. Ms. Dow, I understand that you were born and raised in this area, and that you actually are a graduate of Emory and Henry for your undergraduate and your graduate degrees. Could you tell us a little bit about what made you choose Emory and Henry for your degrees, and also a little bit about the history of the main campus at Emory and Henry?
I would love to. So Emory and Henry is actually founded in 1836 and has such a rich history. It's survived hundreds of years, including wars, technology changes, educational changes, and it's come a long way. It's even opened the School of Health Science now, which is doing great things for the community. And I've loved being a student here, not only for that rich history, but because of the great education I got here and the great service-oriented community. And I was so happy to call it home as a student.
That's wonderful. It's good to know that there are such deep roots with Emory and Henry, and now that they're expanding with the School of Health Sciences. Christina, I understand that you actually are not from this area, but you chose to relocate and move to this school and this area. Could you share with us what that decision looked like for you?
Sure. Emory and Henry's mission statement to assist in meeting the healthcare needs of underserved residents in rural Appalachia is what initially led me to the program. While researching programs, it was the first mission statement that truly encompassed my reasons for becoming a PA. I went to undergrad in the Appalachian Mountains, and I hadn't planned on returning, but something always draws you back, be it the beauty, serenity, or community. In fact, the surrounding community is one of my favorite aspects of this program, and I hope that I can give back to the residents of this town.
That sounds wonderful. It makes me want to be a student as well, just listening to y'all. Julia, would you be able to share with us also, you, I believe, relocated as well to this area. What did the decision look like for you moving to Marion, Virginia for your PA program?
I decided to move to a rural area from a large city in the Midwest for a quieter lifestyle during my studies. Once here, I fell in love with the mountains, the views, and just the overall setting. Everyone in town has been so helpful to us students. They've been welcoming. In fact, some of the residents have offered resources in case I needed them at all, since my family lives over 10 hours away.
That's wonderful. Now that you're speaking about the community, actually, Sarah, could you explain to us exactly what it's like being a student in a rural community such as Marion, Virginia?
Absolutely. Like Julia said, the community has been absolutely wonderful to us as students. Whether they've taken us to dinner, had us over to their home for a meal, or just gotten us a cup of coffee and let us talk about the stresses and struggles of PA school. So since they've been so good to us, we hope that as a program and as students that we can give back to the community as well. And so here at the School of Health Sciences, we have lots of things that are available to the community. This beautiful lobby we're sitting in right now is open to the public during regular business hours. So you can come hang out. We have this beautiful fireplace, comfy furniture. We also have the Lemon Lecture Hall that is open if the community needs it for events or seminars. They're welcome to that. We also have the Obesity Research Center and the Falls Prevention Center, because we hope that we can do things for the community that can help them live a long and happy life.
This is wonderful. Thank y'all for sharing your stories and your decision-making process with choosing the School of Health Sciences at Emory and Henry's PA program. Folks, we'd like to head now into the Lemon Lecture Hall. I believe there's some students that are waiting there for us to discuss some more about the PA school and PA history. We're here in the Lemon Lecture Hall with Professor Wilson, one of the principal faculty here at the PA program, and as well as some of our inaugural PA students. What are y'all doing today?
Well, Professor Justice, we're doing a review for our upcoming clinical medicine exam. We were also discussing the upcoming PA Day.
Oh, that's right. National PA Week is coming up very soon in October. Would y'all be able to expand a little bit and give our audience at home and possibly prospective students a little bit of information regarding the history of the PA profession and PA Week?
PA Week is every year from October 6th through the 12th. October 6th is the birthday of the founder of the PA profession, Dr. Eugene Steed Jr., as well as the first class graduation date.
That's right. In the mid-1960s, there was a shortage of primary care physicians in America. Dr. Steed noticed that and partnered with Duke University. They created the first PA program, and that training was based on the fast-track training that Army doctors received during World War II. The first class was comprised of 4 U.S. Navy hospital corpsmen who were selected based on their already extensive knowledge and medical experience. Now that class graduated October 6th of 1967, and that's special this year because this PA Week marks the 50th anniversary of the PA profession.
That's right. PA Week is coming up, and we do have a very rich and deep and embedded history in our PA program that definitely helps to emphasize why we want to take such good care of our patients. Reza, would you be able to expand a little bit on what PA Week is exactly?
Absolutely. PA Week is significant because it's a great time to spread awareness about the career. There are a number of ways we can educate the public about who PAs are, how they work with patients, and how to become one. And PA Week is the biggest week of the year that we can do so. For example, the PA Political Action Committee is the only federal healthcare committee specifically dedicated to the advancement of the PA profession. This allows PAs to support candidates who truly understand the principles of practicing as a PA. And lastly, PAs are involved in many philanthropic events all over the nation, and PA Week is a good time to help the community through patient education and compassionate healthcare. Caitlin, would you like to expand further on the philanthropy of the physician assistants?
Sure. So actually in 1977, the PA Foundation was established, and its mission was to promote better and more accessible health care for patients. It also awards scholarships and grants so that people can focus on projects both nationally and globally. It can do this through projects that allow PAs to provide novel treatments to diseases. It also can promote access to quality healthcare in America, as well as focusing on public health outcomes for global health concerns. The PA Foundation is a great example of what the PA profession has to offer. So for PAs, that means that the career is meaningful and rewarding, and for patients that means that they see that PAs are truly patient advocates that really want to promote better access and for healthcare.
Professor Wilson, you've been a PA profession now for 25 years. You've served patients in the urban and rural settings. Is there a PA week that stands out to you in your career?
Well, there are many PA weeks, but probably one of the more memorable ones was when I was actually a student in Washington, D.C., and we did a service project at the Library of Congress doing tuberculosis screenings. It's a good time to do projects like that and reach out to the community. I would like to thank you for allowing us to do this, because I don't believe that a lot of local employers are aware of PA Week, and they need to be more aware, because I think they need to be grateful to the PAs that work for them and show appreciation for the hard work that PAs do.
Thank y'all for sharing a little bit with the folks at home and potential students and possible preceptors about PA history and why it is so important to us to know our history, because we are making history. We are adding to the profession, we are moving the profession forward, and we are trying to make sure that we have accessible, high-quality health care to our patients. So thank y'all for sharing this with us, and we will be looking forward to PA Week for sure celebrating. We're going to move now into the Clinical Skills Lab, where I believe we have some more PA students, as well as Dr. Richards, our program director, who would like to share with us some information regarding the didactic phase of our program. We're here in the clinical skills classroom with some of the PA students that I told you about, as well as with Dr. Richards, our program director. Joe, would you be able to tell the folks at home and potential students a little bit about our didactic phase and exactly how that's structured?
Emory and Henry's PA program is 27 months total in length. The first half of the program is didactic, which consists of classes, and the second half of the program is clinical rotations. The didactic year, which starts immediately at the beginning of the program in May, is 3 semesters that build continuously with one another. The program is also student-centric focused and has student representatives that partake in faculty committees. Finally, the goal of the program is to prepare students to be patient-centered providers and also prepare them for the PANCE, which is the certification exam for PAs. Also at the beginning of the program, we have a boot camp or orientation, which Mario will tell you more about.
Thanks, Joe. Yes, as Joe said, the week prior to the first week of classes, we have an introductory boot camp. And during this boot camp, we have preparatory lectures, we have tips on study techniques, and overall, we just get acclimated to the rigors of the PA program here. And also another thing that sets this program apart is the emphasis on mindfulness training. This helps us become better students and, more importantly, more competent clinicians.
Thank you, gentlemen, for sharing that information with our folks. Taylor, would you be able to tell us a little bit about exactly what the coursework is like?
Sure. Our didactic coursework includes 3 semesters of clinical medicine, clinical skills, biomedicine, and pharmacology. Other coursework includes anatomy with a full dissection cadaver lab, research methods, PA practice, and advanced clinical procedures. We also have 2 semesters of behavioral medicine, which is a special feature of our program. Dr. Richards, our program director, will tell us more about this.
Hi, yes. So we are the only program in the United States to have so much behavioral medicine and psychiatry involved in it, and I think the students are better because of it. So along with that, not only do they get the training in neurobiology and psychiatry here in the program, but they also get to shadow me in practicing psychiatry at the Mel Lehman Free Clinic. And we hope this is part of our curriculum really prepares our students to be able to graduate and practice rural family practice medicine and specialty medicine at the highest level. Professor Justice?
Sorry.
Oh, there you are.
I'm right here, sorry. Melody, I was wondering if you would be able to tell us a little bit about what the actual lectures are like here.
Sure. Our program engages students in lectures using active learning tools. And one of the ways they do this is through flipped classrooms, which means that the students prepare prior to class. They utilize that information during team-based learning. This allows class time to be used to discuss case studies and evaluate our knowledge of the material, as well as have increased student engagement.
It's wonderful. It sounds like the program is very thorough in its coursework. I understand that there's a free clinic that's out behind the main campus that allows us to be able to integrate some of our coursework. Christina, would you be able to elaborate a little bit on that for our folks at home, exactly how we integrate the free clinic into our coursework?
Sure. During our didactic year, we have student groups attending the free clinic either weekly or biweekly. The clinical experience solidifies the lectures that we learn in class. This gives us the opportunity to apply the information in a practical setting from our very first week. Not only this, but most of our faculty members are clinicians, which gives us both an academic and a clinical perspective on medicine.
Christine, thank you. That's wonderful. That truly is a blessing and a very special part and unique part of our program here at Emory and Henry, the School of Health Sciences. It's wonderful that y'all have such a strong, structured, didactic phase that will definitely prepare you well for your rotations. Speaking of rotations, I know that there's some students with Dr. Clary and Dr. Boaz that are waiting for us in our gross anatomy lab. So let's head over there and talk with them about gross anatomy and learn a little bit more about exactly how this didactic phase has now prepared our students for clinical rotations. As promised, we're here in our PA program state-of-the-art gross anatomy lab, and with us today we have again some of our inaugural PA students as well as our co-directors of our gross anatomy lab and course, Dr. Boaz and Dr. Clary. Dr. Clary also is our director of clinical rotations. Hannah, could you begin and tell some of the folks at home a little bit about our gross anatomy course?
Not a problem. So we are currently in one of the two cadaver labs we have here at Emory and Henry. I'm with 4 of my team members, and then Dr. Boaz and Dr. Clary. Dr. Boaz is our anatomist, and Dr. Clary is a OBGYN board certified surgeon. We also have a family practitioner that joins us in the lab as well.
We are in the anatomy lab 2 days a week, and each team has their own cadaver. Dr. Boaz's pro section appears on the monitors to guide us through our dissections. We also have computers at each station as an additional resource. We have a total of 7 cadavers with 2 different types of embalming. Dr. Boaz, would you care to elaborate on the different types of embalming?
Yes, the students are dissecting behind me on cadavers that are embalmed with the formaldehyde approach, and they do a full body dissection. The pro-section cadaver up in the front I use to introduce them to the dissection each day. We think this could be very useful for them in their surgical rotations, and I'm happy to introduce Dr. Clary, who is my co-director for the course, who is director of clinical rotations. Dr. Clary.
Thank you, Dr. Boaz. I do believe our anatomy course will greatly prepare our students for their clinical rotations, both in the surgical specialties and medical specialties. I would also like to say that we're very excited about the participation of our local medical care providers who have agreed to precept our students in their clinical rotations. We currently have over 80 local providers participating, representing 15 different specialties. We will also have other participation from providers in other states now that we are a member of the SARA organization. And I would like to turn it over now to Ms. Hayter.
Thank you. Speaking of rotations, this program is special in that not only do we have our usual rotations in surgery, family medicine, emergency medicine, and pediatrics, but we also have additional rotations in psychiatry, hospice, palliative care, women's health, as well as 2 internal medicine rotations focusing on cardiopulmonary and inpatient care. This makes a total of 10 rotations set up for us by Dr. Clary, as well as an elective rotation in our field of interest.
Rotations are something that we're all very excited about. This is when we get to put our didactic studying to use and learn from various PAs and physicians in this community. Each rotation is 4 weeks long, and this is a student-centric program, which is why each site is within 50 miles of Marion. Being from out of state, it was exciting that we also have the opportunity to go to various locations in Virginia, as well as the U.S. Toward the end of our clinical phase, we have a 2-month-long preceptorship. Josh, would you like to talk more about that?
Sure. I know that I'm personally looking very forward to the preceptorship. As Stephanie mentioned, this is an extended 8-week supervised clinical practice experience. It will provide us an opportunity to delve deeper and be provided more comprehensive experience in a specialty that we will likely start our careers in. I believe this will only serve to make us stronger clinicians and to be better prepared upon graduation.
Thank you for taking the time today to speak to our folks at home and potential students about the program, specifically gross anatomy, and truly how engrossed you are with this program, it sounds like. And it's also wonderful to know that you are going to be so very well prepared and versed for your clinical rotations, and that, as Stephanie mentioned, that it truly is a student-centric program where we are trying to consider our students' well-being and making sure that they are close to the school when they do these rotations, or they may decide to venture a little bit further out of the nest. Now we're going to head over back to the school and we're going to find some students that are waiting for us in one of our lecture halls, and they're going to discuss with us what it is actually once they've graduated to be a physician assistant in practice and exactly what they have to do to maintain their education postgraduate. Let's head over there, folks. As promised, we're here now in one of our lecture halls for the PA program with some of our PA students, and they're going to be sharing with you a little bit of information about what it means to actually be a practicing physician assistant and what is required of us once we've graduated to maintain our certification. Kelsey, could you describe for the folks at home exactly what it means to be a practicing physician assistant and what it means to be a certified practicing physician assistant?
I can. A PA is a nationally certified and state licensed healthcare professional. A PA must attend an accredited physician assistant program, usually at a master's degree level, which will qualify a PA to take the PA National Certification Exam. PAs are required to recertify, and they need to take the recertification exam every 10 years and fulfill 100 hours of continuing medical education every 2 years. This ensures that a PA will stay up to date with the latest medical findings and practices and ensures the best possible patient care. Katie, can you tell us a little bit more about PAs in practice?
Sure. PAs are able to do a variety of things in practice. They can treat, diagnose, and prescribe medications. PAs can even function in surgery. PAs are able to function at the level of their supervising physician. Because of this, PAs can work in a variety of fields, from primary care all the way to surgery.
Thank you. That sounds great. Alana, would you be able to explain to the folks at home exactly what the difference is between a physician assistant and a nurse practitioner? I'm sure many of them have seen nurse practitioners locally in their primary care offices and in our ERs, but some of them may not have seen physician assistants. Would you be able to explain to them a little bit about what the difference is for them?
Absolutely. So like PAs, nurse practitioners are considered primary care providers and are able to conduct physical exams, treat illnesses, and prescribe medications. Similar to PAs, nurse practitioners receive a master's or a doctorate education and have to pass a certification exam to initially start practicing medicine. Unlike PAs, however, nurse practitioners are not required to retake a certification exam if they are able to maintain enough practicing and education hours during their recertification period. Also, in contrast to PAs, nurse practitioners are not required to work under a supervising physician, whereas PAs work very closely and in sync with the physician in their chosen specialty. So while PAs and NPs may be competing for the same jobs, their education and training are much different than you would expect.
Elena, thank you for clearing that up. It sounds like there really is a difference in our educations from what a physician assistant's basic education is like compared to what the education of a nurse practitioner is. And then it even goes beyond that once we've graduated, and what is required to maintain our certification as a physician assistant is quite rigorous, having to take our boards every 10 years and maintain 100 hours of CMEs every 2 years, as well as working in sync and collaboratively with a supervising physician. This definitely helps to better the patient's care and to better our education as we grow, as well as working with the physician. It helps them a lot too to have confidence in the support of a physician assistant that they feel closely connected with. Haziel, speaking of connection, once the PAs are out in practice, could you tell everyone exactly what it means to be part of an integrated healthcare team as a physician assistant?
Sure. So basically, PAs work collaboratively with supervising physicians, surgeons, nurses, and other healthcare professionals as well to diagnose, treat, and keep patients both physically and mentally healthy. The PA profession has made the healthcare team more efficient by providing effective care to underserved and underdeveloped areas in our communities. Now John will talk more about PA's scope of practice.
So some of the benefits of being a PA include their ability to switch between specialties. This means a PA can work in anything from surgery to pediatrics to general practice, and they have the option to switch between them as their career goes on. They just need to work with a supervising physician in order to do so. This also means that a PA can fill whatever role is needed most within a community to ensure the best patient care for that community. Another benefit is PAs are also in high demand because of the because of the growing demands for medical professionals in every field of medicine.
Thank y'all for sharing with everyone a little bit about the PA profession, what we can do, what we can't do, some differences between nurse practitioners and PAs, and what it actually is like once we've gotten out there into the workforce and we're actually working collaboratively with healthcare teams. Being a PA also, I can speak personally, has been wonderful in that it's allowed me the flexibility depending on where I've needed to live with my family, that if I wanted to change specialties, I've been able to do that. And I've enjoyed a career thus far in hospitalist medicine and emergency medicine as well as in pediatrics. And I thoroughly have enjoyed my time in rural medicine, which is a very near and dear focus for this particular program. So thank y'all for sharing this with everyone. I know y'all are very eager to earn your C's so that you can be out there practicing yourselves. And speaking of actually being out there practicing and helping our underserved community, we're now going to venture over to the Mel Lehman Free Clinic that I mentioned to you earlier today, and we're going to see some actual PAs there practicing that are members of our faculty team here, as well as some of our students. As mentioned before, our students are actually already there seeing patients from the very first week of classes. So let's head over there and see what's going on at the Mel Lehman Free Clinic. Welcome back. We're now here visiting at the Mel Lehman Free Clinic that is here behind our main campus. We're here today with some of our physician assistant students, as well as Michael Armbruster, who is the director of the Free Clinic, and Amanda Fleener, who is one of our faculty members at the school. Michael, would you be able to tell us a little bit more about the Free Clinic?
Of course. The mission of the Free Clinic is to enhance community well-being by providing free, compassionate, comprehensive, and high-quality healthcare services to the underserved in Smith, Grayson, and Washington counties.
The Mel Lehman Free Clinic is partnered with Emory and Henry's College, but does not receive funding directly from the college. Most of the funding received is from the communities served. Donations are an important part of Mel Lehman's Free Clinic's ability to provide care to patients. As students, we are able to shadow providers from day one and are able to interact with the patients. It is important for us to wear our white coats while working in the clinic, since we are the only program in the country that is able to have first-hand experience from day one.
While at the clinic as students, we are able to learn from the front to the back everything that goes on with our patients. So as they check in, as they're getting rescheduled, as we go to the back and do procedures that are taught by Professor Fleener here, as well as Professor Howe, who you'll meet later on, we are able to learn every aspect of the clinic as we learn as well at the school.
Here at the clinic, we provide some chronic health services for our patients, such as treating high blood pressure, diabetes, high cholesterol levels. We also provide some acute care services, such as taking care of colds and flus, urinary tract infections, sprains and strains. We also offer limited women's health and behavioral health services. We work with our patients to help overcome another barrier to care, which is medication cost, by participating in various prescription assistance programs that help them to acquire medications for free or reduced cost. We're also branching out our services to help provide for another important need for our patients, which is oral health, and we provide dental hygiene services for patients 1 day a week at the clinic.
Thank you, Amanda. This is wonderful. This is such a wonderful service that we're able to provide for the community, and what a blessing to be able to have the students here from the very first day of class being able to utilize their skills and knowledge that they're learning in class. Mr. Armbruster, Professor Fleener, thank you so much for being with us. Folks, let's head over and see if we can find some more PA students, and I believe one of the other PAs that works here, Mr. Howe, is available in one of the exam rooms. So let's go see if we can find them. Well, here we have some PA students working here in the clinic, it looks like, with the slit lamp. And we also have Harry Howe, who is one of the clinic PAs here at the Free Clinic that you may see if you come to the clinic. He also is one of our adjunct faculty. Adrian, could you tell us a little bit about what's going on?
So all of the services at the Mel Lehman Free Clinic are available to residents of Washington, Grayson, and Smith counties who are uninsured and at or below 200% of the federal poverty guidelines. It's estimated there are 4,700 people who are eligible for care from the Mel Lehman Free Clinic.
So if you're interested on making an appointment, you can find us at 601 Radio Hill Road, Marion, Virginia, 24354. It's located in between the old Smith County Hospital, which is now Emory and Henry School of Health Sciences, and the Lifetime Wellness Center. Please bring your photo ID, your tax return, and any current medications with you on your first visit.
All of us here at the Mel Lehman Free Clinic work hard every day to provide for our patients because we truly take patient care to heart. If you would like more information, a great resource would be mellehmanfreeclinic.org. If you'd like to call us, you can reach us at 276-781-2090. And if you'd like to send us an email, you can send us an email at info@mellehmanfreeclinic.org.
Thank y'all. That sounds wonderful. This is such a wonderful place for people to come and receive wonderful care. Professor Howell, would you be able to explain to us a little bit about how the clinic has actually enhanced the students' quality of education?
Because of the partnership with Mel Lehman Free Clinic and the Emory and Henry School of Health Sciences PA program, we're able to have patients here in the clinic that are agreeable to let students come in and do assessment and also begin to do some of the procedures as well as treatment plan. So students, it enhances their educational process, but also it begins to become internalized as they put to practice what they learn in the classroom immediately. So when they go out on clinicals, they're well prepared and have a lot more confidence in that stage of their education.
Wonderful. Thank y'all for taking some time to speaking to everyone. And Professor Howell, thank you for your diligence in teaching our students and helping to serve this community. Folks, I hope you've enjoyed our tour today. We're going to go and step out front of the building and see if we can collect everyone together to say goodbye to y'all. Thank you so much for spending your time today with us here at Emory and Henry's Campus School of Health Sciences and our PA program. We were so happy to get to spend this time with you and share with you information about our program, our education, the profession, our history, as well as information about the beautiful Mel Lehman Free Clinic that's here to service our community and to enhance our students' education. Please feel free to reach out to us here at the school or at the free clinic with the information that we'll be following shortly. Again, thank you so much, and we all hope that you have a wonderful day.